Hello, and thank you for making time to view this presentation on a new way of working grant funding in DSS. We understand that it has been a period of uncertainty for many service providers. Many of you are likely to already be funded by the Department of Social Services and are aware that the government is offering extensions and some renewals for grant agreements that were due to expire on the 30th of June. This will allow us time to transition to new grant arrangements while ensuring services continue. The recent federal budget included the announcement of the Department's new grant programs and a range of improvements to the way grant programs will be managed into the future. The purpose of this presentation is twofold: to give you an understanding of the new grant arrangements in DSS in their entirety, and to give you the current available information on the selection processes that are opening on the 19th of June 2014. The upcoming selections will be the beginning of implementing to new arrangements. Importantly, in order to be considered for new funding or funding beyond the recently announced extensions, you will need to apply for funding from the 19th of June. This presentation will cover the new DSS Grant Program Suite, the application processes for funding under the new program suite, new grant funding arrangements, and improved reporting requirements. This presentation will provide as much information about the new DSS Grant Program as possible at this point in time, noting there is some information relating to the specifics of the selections process that won't be available until the selections formally open on 19 June. We think there is merit in using this time ahead of the selections process opening to explain the changes to the department's structure and new grants programs, and to point out the opportunities for service providers before service providers think about applying for funding. Understanding the changes will help with the application process. Please note all of the information contained in this presentation is also available via the DSS website. This presentation is focused solely on the new grant arrangements in DSS and won't discuss funding provided outside of grant agreements. Therefore, this presentation will not cover other processes the government is engaged in that are linked to changes to the DSS programs, including Disability Employment Services, Disability Management Services, Aged Care Reform Consultations, and the Aged Care Approvals Round. There are separate sector briefings on the aged care reforms and the Commonwealth Home Support Program that are occurring from now until the end of June. If you are interested in attending one of these sessions, information about the dates and locations is available on the DSS website. Details of the selection processes will also be available on the DSS website. To find out this information as soon as it is available, you can subscribe for updates, also via the DSS website. So why are we changing our grants arrangements? The Australian Government is committed to working more effectively with civil society organisations to deliver valuable services for individuals, families and the communities. The Minister has made many statements on his commitment to civil society. Most recently at the opening address to the Building Partnerships Between Governments and Not-for-Profits conference on the 20th of May 2014. Here he again stated the government remains committed to slashing red and green tape to make it easier for both the not-for-profit and for-profit sectors. The government is implementing a broad deregulation agenda to boost productivity by removing excessive, unnecessary and overly complex red and green tape imposed on business, community organisations and individuals by at least $1 billion a year. The Minister has ensured that the new way of working incorporates the feedback he has received from service providers over the years. Much of this feedback has been about the need for red tape reduction across all elements of receiving a Commonwealth grant. This is also feedback that the Department has received. The Government is also committed to providing greater certainty for social service providers to improve service delivery for the community. That is why the Department will also be offering longer-term funding arrangements in the form of 5-year grant agreements across our grant programs where it is appropriate. However, as is also clear to you all, we are working within a tight fiscal environment. These changes recognise the need for government to work more efficiently and effectively with civil society, while ensuring individuals, families and communities are supported. With all this in mind, DSS wanted to establish a new way of working that improves the administration of grants programs, better supports civil society, reduces regulation, and increases the efficiency of grant spending. As you may be aware, the Department of Social Services was established in late 2013 and brought together grant programs from 5 different departments. As a result, DSS inherited 18 separate discretionary grant programs comprising of approximately 120 grant activities and around 12,900 individual grants. Looking at the management of grants administration across the 18 discretionary grants programs, opportunities were identified to reduce duplication, capitalise on synergies between programs and activities, promote innovation and flexibility to better respond to emerging policy priorities, and streamline application processes. The new DSS structure, outlined in the 2014-2015 portfolio budget statements, now has 5 consolidated outcomes replacing the previous 11 outcomes, including its grants programs of Social Security, Families and Communities, Ageing and Aged Care, Housing, and Disability and Carers. I will run through the new DSS grant program structure in the next few slides. Some elements of these new programs and their activities will be part of the 19th of June selection processes. Some will not, but all DSS grants funding will only be available under these new program structures after the expiry of current grant agreements. We have incorporated the 18 former grant programs into a streamlined, broad-banded structure of 7 grant programs to align with the government's civil society agenda. These new programs include the 4 existing and already broad-banded programs in Ageing and Aged Care, Home Support Program, Residential and Flexible Care Program, Workforce and Quality Program, and Ageing and Service Improvement Program. Additional to these are 3 new programs: Families and Communities Program, Housing and Homelessness Program, and Disability, Mental Health and Carers Program. I'll talk you through these programs now. The new Families and Communities Program involves activities to support individuals, families, children, young people, women, carers, refugees and migrants, and people experiencing or at risk of homelessness, as well as community development and support services. This program represents the bulk of the department's grants. The existing programs in this sector have been streamlined into the new Families and Communities Program. This new program will continue to provide the valuable support to meet the needs of individuals, families and communities that the previous programs provided. The new program has been designed to join up early intervention and prevention services across communities to support the stability and well-being of the families, networks, neighbourhoods and communities that form the fabric of Australian society. Joining up the practical elements of support needed by individuals and families will maximise the outcomes that can be achieved from grant funding while reducing duplication and inefficiency for service providers and government. The 7 grant activities under the Families and Communities Program are Financial Wellbeing and Capability, Families and Children, Strengthening Communities, Settlement Services, Civil Society, Families and Communities Service Improvement, and National Initiatives. This new program and its broader activities provides the opportunity to maximise the benefits to individuals, families and communities by joining up the practical elements of support. More detailed information and fact sheets for this program and its activities can be downloaded from the DSS website. As previously mentioned, the 4 existing Ageing and Aged Care programs are unchanged. These programs were previously streamlined by the former Department of Health and Ageing in 2011. As a result, they already offer an effective approach to service delivery with a focus on service improvement through flexible funds. That is why the Department hasn't made any major changes to the existing Ageing and Aged Care programs at this time, with the exception of minor refinements to the activities within the Ageing and Service Improvement Program. As previously mentioned, separate sector briefings on the aged care reforms are being held from now through to the end of June. The new Housing and Homelessness Program will provide support for early intervention initiatives to reduce homelessness and its impacts, funding for research into homelessness and housing issues, and the creation of effective and efficient housing assistance programs and build viable communities. The Housing and Homelessness Service Improvement and Sector Support activity is the only grant activity in this program. As such, this activity covers the spectrum of grants provided in the housing and homelessness space, including research, sector improvement, and raising awareness. A notable change in the Housing and Homelessness Program is the alignment of some homelessness support services under the new Families and Communities Program. It is important to emphasise that homelessness support services are still a policy priority for the government. The merging of services under the Families and Communities Program does not reflect a change in desired outcomes. Instead, it represents a desire to provide a continuum of services through life events. The Families and Children and Financial Wellbeing and Capability activities include specific focus on recognising people at risk of homelessness and providing early assistance to prevent homelessness. It should be noted the majority of the Department's housing-related activities are not discretionary grants and therefore not affected by the changes. The Disability, Mental Health and Carers program will provide support for people with disability, mental health issues and carers. This program has a focus on early intervention, support through community-based initiatives, and actively seeks to help individuals with disability to find a suitable position in the workplace. The priority areas within this program are represented by the existing activity, Disability Employment, with 3 new activities: Community Mental Health, Disability and Carer Support, and Disability and Carer Service Improvement and Sector Support. The new activities reflect the approach taken across the grants programs of clustering together activities that have synergies in terms of service delivery. Alongside this program, there will be numerous DSS grant activities and grants transitioning to the National Disability Insurance Scheme over the next few years and concluding in 2018. I will now run through a couple of examples from the new Families and Communities program to illustrate how these changes improve outcomes for individuals, families and communities. The new Financial Wellbeing and Capability activity is designed to deliver a more integrated and coordinated service that promotes financial capability by helping people avoid or resolve financial difficulties and achieve self-reliance. The new activity will offer a person-centred and more holistic approach to provide a continuum of support for people from early intervention and prevention through to budgeting and financial education. This presents the opportunity to ensure providers will be better able to offer targeted assistance and ensures consumers and communities can better access services to build longer-term financial capability and financial inclusion. The Family and Children's activity will build on the former Family Support Program and strengthen service delivery. This activity will focus on early intervention and prevention, including early intervention to prevent relationship breakdown to provide the best opportunity for Australians to fully participate in society, enjoy strong relationships, and ensure that children are supported to reach their potential as adults. The new activity aims to build the capacity of the community sector and increase the use of evidence-based practice to meet the needs of Australian families and ensure those families are receiving the most effective services. Under the new activity, services will be encouraged and supported to be innovative in approaches to social and family issues in their local communities. The activity promotes integrated service delivery, which is a proven method of assisting vulnerable children and families to receive the most appropriate services in the timeliest manner. It also provides a comprehensive service system in communities through shared vision, addressing gaps and preventing unnecessary duplication of services. This new way of working represents a significant shift in grants program management. The new broad activities reflect the way services are delivered in communities and recognises that many organisations deliver more than one service. Instead of funding specific services in isolation, we are capitalising on the synergies across services. This new way of working also acknowledges that the needs of individuals, families and communities change, and that service providers need flexibility to adequately respond. The broader activities reduce the prescriptive nature of grant funding and instead promotes innovation and flexibility to better respond to emerging policy priorities. This all reduces duplication both in service delivery and administration. This frees organisations up from reporting to government to allow them to focus more on delivering services in the community. You will have fewer and less prescriptive program guidelines to comply with and less application processes to engage in. The new way of working also provides a foundation for integrated, community-led program delivery that understands and meets local needs and promotes innovation and collaboration. For example, service providers could deliver more than one service, commit to collaborating on a local basis with other providers, engage or fund smaller local organisations to deliver a component of the services, respond more rapidly to emerging local needs, and work together to identify service priorities. The government wants collaboration to be a service priority for funded organisations. It is a critical part of service delivery, particularly for vulnerable Australians. Collaboration means that local services are better planned with fewer gaps, there is less duplication, referral systems are stronger, limited resources are shared, and complex social problems are approached in a unified way. Although collaboration can be resource intensive to begin, there are great benefits to both services and clients in the longer term. While many of you already collaborate widely with other services in your local communities, we want to encourage greater collaboration between service providers to ensure the best outcomes are achieved for individuals, families and communities. The Department is formalising these arrangements going forward. For example, for providers in the Families and Children activity, working in a silo is no longer acceptable. Collaboration is a service quality outcome under the new performance framework, and providers will need to demonstrate outcomes reached using collaborative approaches. We want you to keep collaboration with other service providers in mind in both formal and informal ways when you apply for funding. We recognise that you are all very keen to know when you can apply for funding. The rounds will open on the 19th of June 2014 and close 5 weeks later on the 23rd of July. The Department will publish all program guidelines and application materials on the DSS website at that time. There is also a free email subscription service available from www.dss.gov.au/grants that will notify you of key updates to the website, particularly around the upcoming application processes. We will be operating a telephone hotline, the DSS Grants Hotline, to provide technical support for applications and manage related queries throughout the application period to further assist organisations with their grant applications. We will be offering a new online application process that will be easier than previous application processes, in line with the government's commitment to reduce unnecessary red tape. Since the announcement of the new programs through the budget, the DSS Grants Hotline has been available to manage queries about the revised program structure and extensions to existing agreements, and to provide technical support for applicants. Queries that can't be answered by hotline staff are escalated to an assessment team, with the responses published on the DSS website so that all service providers have access to the same information. A frequently asked questions section is included in the DSS website. This section will be updated throughout the application and assessment period, and you are encouraged to check for updates. These questions are designed to anticipate the queries of potential service providers and to minimise confusion. The Department will endeavour to answer all questions received through the hotline in a reasonable timeframe before the closing date of the application period. However, it is recommended that you get your questions in as early as possible. The Department cannot guarantee that your questions received in the last few days before the closing date would be answered on time. For those of you with a 12-month extension to your current grants, those grants will continue under the current arrangements until the 30th of June 2015. Further application processes in relation to those grant activities will be conducted early next year. The Department's website will continue to be a key source of information regarding those processes. There will be a range of selection processes opening on the 19th of June, including open selections and direct approaches. The selections will be advertised in all major newspapers around Australia on the 7th of June. A small number of grants have funding agreements in place until the 30th of June 2015 and the 30th of June 2016. These arrangements will continue until their expiry. Further information on how these grants will transition into the new arrangements will be provided to funded organisations closer to the conclusion of these agreements. While these agreements are still in train, there is also an opportunity for service providers to expand on the services they offer and or extend their footprint by applying in the upcoming selection processes. The Department is introducing the DSS Streamlined Grant Agreement for new funding offers from the 1st of July 2014. The DSS Streamlined Grant Agreement offers a significant reduction in clauses compared to previous agreements offered by the Department, and it is written in plain English. Further improvements to the DSS Grant Agreement will mean that from July 2014, multiple activities can be accommodated using one set of terms and conditions, and the majority of service providers would only be required to comply with one set of terms and conditions when doing business across DSS programs. This means that high-performing service providers that are effectively managing their grants will be subject to less red tape and minimal reporting. Of course, there will be funding situations where the DSS Streamlined Grant Agreement will not be suitable for use. These include small one-off grants such as volunteer grants, emergency and disaster payments, capital funding or building land lease, intergovernmental funding, individualised support, fee-for-service or panel arrangements, such as helping children with autism or stronger relationships, and funding of high-risk organisations. A standard, more comprehensive agreement would be offered. For those of you with grants to deliver family and relationship services, family law services, and communities for children facilitating partners services, you are well aware of the government's commitment to a longer-term funding, as 5-year grants are being rolled out for these highly specialised and unique services. The government has made clear its commitments to delivering strong outcomes for Australian families and focusing on early intervention and prevention. Refunding these services for 5 years reflects the maturity of these services and their strong record in delivering quality services for Australian families. The Department is looking to provide this level of funding certainty to service providers funded across our grant programs. As part of the upcoming selection rounds, we will be offering 5-year grant agreements to successful providers where it is appropriate. What this means is that some types of grants may not be suited to these longer-term grants, such as those for one-off short-term services, trials and pilot services, or higher-risk services or service providers. However, we expect that the vast majority of the service providers we fund will be eligible. We are currently reviewing the way we collect program performance data from service providers, recognising that you collect data for a range of reasons, not just to fulfil DSS reporting requirements. The way we collect and use data will be simplified, outcomes-focused and easily reported. The Department will reduce reporting to a set of consistent, mandatory priority requirements. This is a small set of priority questions informed by your normal interactions with clients, either as part of your intake and assessment process or routine case management. The 8 priority requirements have been designed to leverage the information you collect through your usual business processes: client name, collected but not disclosed to DSS, date of birth, gender, residential postcode, Indigenous status, CALD status, disability, consent, and the consents to participate in follow-up surveys, research and evaluation activities. Operating alongside these priority requirements will be a new partnership arrangement where you can opt in to provide additional data to the Department in return for receipt of regular and relevant reports back from us. These reports will draw on a rich set of information to help inform service delivery, including program performance data, client surveys, and government data sets using de-identified population data such as the Australian Bureau of Statistics and the Department of Human Services. These new and improved reporting arrangements will be implemented progressively over the 12 months following 1st of July 2014. These arrangements will significantly reduce the administrative effort for service providers and allow you to focus more on service delivery. This new approach to reporting will be supported by a new system called the DSS Data Exchange. It will be available from the 1st of July 2014 through the DSS website, www.dss.gov.au. The DSS Data Exchange will eventually replace the existing systems, such as the Family Support Program Data System, which some of you will be familiar with. The new web-based portal will be flexible enough to accommodate system-to-system data transfers, the bulk uploading of files, and direct data entry. We know that you need time to implement changes to data collection and will work with you to transition to the new arrangements. However, the new system has also been developed to enable us to work together to share data, insights and lessons without making it an onerous obligation on all providers. More information, frequently asked questions and instructions on the DSS Data Exchange and the changes to the reporting requirements are currently available on the DSS website. So what does this all mean for you? Broader programs mean service providers can be funded to deliver services wider in scope than the department's former programs allowed. Rather than applying for prescriptive activities, you will be able to apply for an activity such as financial wellbeing and capability with a broader outcome-focused remit. This will provide flexibility for the department to identify priorities within activities based on recent research and/or government priorities, and allow service providers to propose innovative early intervention and prevention services that are appropriate to the needs of the communities and clients they serve. Consolidating funding rounds for each priority area will mean less administrative burden for service providers and for the department, while providing scope for funded organisations to have more say in the way they achieve outcomes. Service providers could, for example, deliver more than one service, commit to collaborating on a local basis with other providers, or engage or fund smaller local organisations to deliver a component of services. Over time, this approach will be more likely to empower civil society, encourage volunteering, and work to deliver services that better meet local needs. Broad-banded programs will also reduce the number of program guidelines and, in turn, reduce the administrative and reporting burden for service providers, allowing them to focus their efforts on more supporting their clients. Broad-banded programs will also reduce the number of program guidelines and, in turn, reduce the administrative and reporting burden for service providers, allowing them to focus their efforts more on supporting their clients. These changes are part of the Australian Government's commitment to reduce red tape by $1 billion per year so that service providers, families, businesses and the community organisations can benefit from more efficient regulation. The most important point is that in order to be considered for new funding or funding beyond the recently announced extensions, you will need to apply for funding from the 19th of June 2014. The Department acknowledges that many service providers are feeling uncertain about the future of their funding, and these changes could be a lot to take in a short amount of time. We hope this presentation has provided some clarity about these new arrangements. It's just one way we're trying to support organisations to understand the new way of working and get the most out of it for their clients. As most of you will have seen, the DSS website is the centre of information about all of these arrangements. The website has all of DSS grants information in one place and will include frequently asked questions, information on the programs for which grants are available and information on selection processes. It is continually being updated, particularly as we get closer to the opening of applications for funding, and you can subscribe to updates on that website. We also have a telephone hotline set up. The number is 1800 625 136. You can call with questions or you can email them to us at grants@dss.gov.au. We want to hear from you. We will put answers to questions on the DSS website for all to see. Thank you for your time in listening to this presentation.